Hi, this is the second video of CPR series, and so we saw a person unconscious, and we are going to deal with that person. And how should our approach be? First, we'll see to it that the surroundings isn't dangerous, and the victim and both the victim and the rescuer, that is we ourselves, we are safe, and we are going to begin. And that is with with checking his level of consciousness by asking or by shaking the person and patting on his shoulders, and we ask him, are you all right, are you okay? These are our questions, and we don't get a response, and then we'll understand that the person is unconscious. And what if he is unconscious? What happens? His muscles his muscle tone gets lost, and muscles do not contract, and we know tongue is a muscle, and tongue doesn't contract, means it remains in a relaxed state, and in the relaxed state tongue is going to cause obstruction to airways. So we have to, next step is that head tilt and chin lift maneuver, and we'll see that in the next video. And after that, after seeing that airway is clear, there is no obstruction, the next step is we have to check the breathing of the person, and for that we'll check that look, feel and listen technique. Look is, we'll look whether his chest is rising up and down, or whether we can feel it with our hands on his chest, and whether we can listen to his breathing breaths, and then that sound. And okay, that is done, and we find that the person is breathing. So immediately we'll put him in recovery position, and in that position that obstruction doesn't occur again. That is, tongue obstructing is airways, and we'll see into that also in the next video. And and we came to know that the revised guidelines say that it is CAB. Even then we have to go through this order like A, B, C, but we shouldn't delay. That is why they put that C in the top. That is, we have to give, if we find that the person isn't breathing, we have to give 2 effective breaths immediately, and we might be looking for a device, and instead of giving direct mouth-to-mouth breaths, we might go in search of a device, and we get time gets lost, and we might end up not being able to do compressions. And so to avoid that, our first main concern should be compressions. If that is there in our mind, rest all we'll find our way, and things will get done soon. So we find that we'll give 2 effective breaths, and his breathing is normal. Then we'll immediately check his carotid pulse, and how long will we take to check the pulse? Not the usual 1 minute or 30 seconds, because we are not going to count the pulse. We don't want the pulse rate. We just want to see whether there is pulse or not. So for that, we'll just we have just 10 seconds. Maximum time allowed is 10 seconds, and that is between 5 to 10 seconds. We have to make a judgment whether he has pulse or not. And if we find that he has pulse, then what we can do is we can continue with that rescue breathing that we did above. And then we have to continue with the rescue breathing, as well as we have to keep checking his circulation in every 1 minute. And because if circulation starts to get low, it's going to be stopped. That's the time like we have to immediately start giving compressions. And compressions, if we like within 10 seconds of knowing that the person has lost his pulse, we have to begin compressions. And how to do the compressions and the ratio we'll deal right now. Compressions is 30:2 is the ratio, that is the ratio for an adult, and for every 30 compressions we have to give 2 effective breaths, and it's a strenuous activity, but it's worth all that. And how to give compressions? First, we have with the heel of our hand, we give compressions. We put the heel on that center of the chest, that is towards the lower half of that sternum or breastbone, and then on top of that hand, our first hand, we'll put the second hand, the heel on top, and we'll interlock the hands, and we'll give compressions. And at the time of giving compressions, our elbows should be in an extended form. Then only we'll be able to give correct compressions, and that's the main point, and we shouldn't forget that. And likewise we have to give compressions for 5 cycles, and that is in a minute the rate of compressions is 100 per minute, 100 compressions per minute. And in the case of breaths, for one breath we should take 1 second, and likewise 10 to 12 breaths can be done in like after one breath 5 seconds gap, and so in 1 minute we can do 10 to 12 breaths we can give. So that is about compressions and giving breaths, and hope it was informative. In that last final one, we'll deal with the recovery position and head tilt, chin lift maneuver, and also jaw thrust maneuver. Thank you.